The Aroostook Medical Center has now implemented advanced asthma testing for older kids, primarily adolescents and teens, says TAMIC pediatrician Dr. Peter Morningstar.
It has encouraged us to take the next step, which is to expand services to those that you would be more likely to expect either from an allergist or a pulmonologist. We'll be providing spirometry services, which is advanced asthma testing, and follow-up testing for kids who have asthma.
A few months ago, TAMIC received an accolade for their ongoing documentation of working with pediatric asthma patients from the Maine Health Management Coalition. Dr. Morningstar says receiving the recognition is one thing, but it should inspire clinical staff to take the next step in treating young asthma patients, helping kids to properly manage their disease and even medication, with parental guidance, of course.
Continue to make sure that kids are on the proper preventive, controlling asthma medicines so as to avoid in advance asthma attacks, and to not so much provide new education to parents, but to reinforce those things that people always need reminding of.
Dr. Morningstar cites pediatric asthma as a common chronic health problem on the rise in Maine, even more so than hypertension and diabetes. Of his young patient population aged 3 months to 21 years old, he says it's important healthcare practitioners partner with families to achieve one goal: getting kids with asthma to live healthy lives. On the healthcare side, he says that begins with asking the right questions.
Because of asthma in the past year, how many trips to the emergency department because of asthma for in the past year, and whether we're asking about that information. Not so much what is the number, but are the questions being asked? Are we documenting tobacco exposure for the children who have asthma? Are we offering influenza vaccination?
But he says a successful community partnership, one where parents and physicians are working together for the betterment of kids with asthma, is helping youngsters understand first and foremost that the disease can be managed.
People know the things that are helpful to do, which is to say, keep children with asthma away from cigarette smoke. Extremely important. Most people know that, and most people make an effort. But with regular asthma care, you can kind of encourage and reinforce that message.
Sean Cunningham, News Source 8.